If you've ever been to a hospital in Armenia, especially outside Yerevan, you know exactly what I'm talking about. Too few medical staff, inconsistent quality of care, and at times conditions so degrading they strip you of your dignity. Access to quality health care isn't a privilege, it's a fundamental human right. Yet in Armenia, that right still depends on how much money you make, your address, and whether you can afford to get sick. Hello, my name is Maria Titizian, and welcome to It Has to Be Said. Nearly 1 in 10 Armenian households spend more than a quarter of its income on medical expenses. 6% fall into poverty because of healthcare costs, the highest rate in the region. And countless people, including nearly half of those in extreme poverty, delay or avoid medical care altogether, simply because they can't afford it. For the past 25 years, public health spending has averaged around 1.4% of GDP, roughly 4 times lower than comparable countries. And the consequences are everywhere. Underfunded and outdated polyclinics, hospitals running out of state financing, and even services that are supposed to be free often come with hidden or informal payments. Back in 2018, this administration pledged to introduce universal health coverage. The process stalled for years. Until now. A new proposal has revived momentum. Under the plan, taxpayers would pay a monthly healthcare fee, roughly 10,800 dirhams or $28, while the state fully or partially subsidizes coverage for vulnerable and low-income groups. Health officials have been careful not to commit to a launch date, but Prime Minister Nikol Pashinyan recently pushed publicly for January 1, 2026, saying the reform should not be delayed any further. Countries that adopt universal coverage typically see stronger economies, reduced inequality, and healthier, more resilient populations. But this model isn't a magic fix, and Armenia may not yet be fully prepared for the administrative and financial demands it brings. Everything will depend on implementation, transparency, political will, and real safeguards to prevent corruption. Will universal coverage solve everything overnight? Of course not. But healthcare is not just about surviving, it's about living with dignity. Building a fair, equitable Armenia means ensuring that every person, no matter their income or circumstances, has access to the care they need. It has to be said, or perhaps more astutely asked, can this administration guarantee that right while navigating a system that demands far more capacity than our institutions currently have?